regards to some of the confusion, I want to apologize on Friday in regards to how the budget recommendations are coming from the budget committees. The information is going to be sent to you as it was prior to Friday's meeting to you by email. It's also uploaded on the Kansas Legislature website. If you would like to have your assistant print those documents out, since we had some meetings earlier in regards to going paperless, please let your assistant know to have those documents printed out for you in regards to the budget recommendations that came from the budget committees. In regards to the budgets that we're going to be talking about today, that link has been sent to each and every one of you. So you can either look at it on your laptop, have it printed out by your assistant, but also you can look on it on the Kansas Legislature website. Also, the budget books are printed, so we do have those, and I see some members have already accessed their budget books, but they are in the cabinets around the room, so you can refer to the budget books in regards to the budgets that we're going to be reporting. Representative Helgerson.
Mr. Chairman, then, as I understand, we'll get the report, the recommendations from the subcommittees or from the full committees a day ahead of time?
Technically, and I think Kathy may help me on this, I think it's 2 hours before the committee meeting, and that was by the revisor's office saying that that information cannot be shared until 2 hours prior to our appropriations meeting.
Okay, so we'll get it 2 hours ahead of time, and at that point, it's a public record.
Yes.
Okay, thank you.
And so if you want to have your assistant print that out for you so you can bring it to committee, you'll have the link before we have the meeting on that day.
Thank you.
Any other questions in regards to this new process of looking at the budgets? All right, not seeing any. Do we have any bill introductions this morning? Not seeing any. You should have received the minutes for the January 28th meeting. Were there any changes to those minutes? There's been a motion by Representative Hoffman. Is there a second? Second by Representative Buchanan. All those in favor of approving the minutes for January 28th, please say aye. Aye. Opposed? Minutes are passed. Committee, you should also receive some annual reports that have been distributed to all of you, which is required by state statute. And those reports include the NIAR National Center for Aviation Training with Wichita State University, the Midwest Stem Cell Therapy Center, University of Kansas Cancer Center, Global Food Systems Investment Summary with Kansas State University, and NCAT, the National Center for Aviation Training with Wichita State. So you should have those at your disposal. First up, we're going to have an update. This is actually a recommendation by the Joint Legislative Budget Committee in regards to the Kansas Mental Health Modernization and Reform. And so right now I will turn it over to Carly Houchin with the Kansas Health Institute.
Very good. Good morning, Chair Waymaster, members of the committee. Can everyone hear me okay?
We can hear you, yes.
Great. Well, thank you so much for this opportunity to provide a report on the working groups of the Special Committee on Mental Health Modernization and Reform. My name is Carly Houchin. I work as a senior analyst at the Kansas Health Institute. And the team over at KHI provided facilitation and report development for the strategic framework that we'll be briefly overviewing this morning. So as you're likely aware, the Special Committee on Mental Health Modernization and Reform met between August and December of 2020. That group, led by Representative Landwehr, was interested to put together a long-term strategic plan for modernizing the behavioral health system in our state. To accomplish this, that group established working groups through which they engaged dozens of experts. Additionally, the group relied upon work that had been done across 5 previous collaborative efforts, such as the Mental Health Task Force and the Child Welfare System Task Force. The working groups established included those on finance and sustainability, policy and treatment, and system capacity and transformation. Additionally, volunteers from each of those 3 working groups came together in a subgroup to take up the topic of telehealth. And in just a couple of minutes here, you'll hear briefly from each of the co-chairs of those working groups about the details of the work that they led. So the working groups made recommendations based on the 10 topics that were assigned out to them by the special committee. And so those 10 topics provide the kind of backbone of the strategic framework as well. So the strategic framework moves working group by working group and moves through each of the 10 assigned out topics. The working groups determined up to 5 high priority recommendations for each of the topics assigned out to them. And collectively, these high priority items form the strategic framework that should be considered as a living document to support ongoing collaboration between the many contributing partners in the behavioral health system. At the highest level, the final report includes 3 key components. One, it includes vision statements for modernizing as it relates to each of the 10 identified topics. So as an example, one of the topics is workforce. So there's a vision statement in there as to what the working group meant by a modernized behavioral health workforce. Additionally, the strategic framework includes a data profile to provide a brief snapshot of the performance of the behavioral health system in our state. And then lastly, and the bulk of the report is the high priority items or recommendations developed by the working group members. So the working group, the body of the report includes tables that detail the recommendations along with the relevant context there. With that, I will pause and turn it over to the working group co-chairs for more detailed information. But thank you again for this opportunity to provide just a really brief background on this report. I'm joined on the WebEx link this morning by my colleague Hina Shah, who co-led this work, and we will both be available to take your questions at the appropriate time.
Are there any questions for Carly? All right. Seeing none, thank you for being here today. The next individual that we have is Greg Hennin from the 4 County Mental Health Center.
Yes, thank you, Mr. Chairman and members of the committee. My name is Greg Hennin. I presently serve as Executive Director of 4 County Mental Health Center. We're a community mental health center serving multiple counties in southeast Kansas. I had the opportunity to serve as the co-chair of the Finance and Sustainability Subcommittee and appreciate the opportunity to provide you with an overview of the recommendations of the subcommittee's work. We reviewed recommendations of the past several work groups that to date has not been enacted, and then we further evaluated the present day population and system needs. So as you'll see from the submitted written testimony, there are 3 to 5 recommendations addressed in the areas of workforce, funding and accessibility, and community engagement. In the interest of time, since I believe I have 5 minutes, I'll only report today on the top or number 1 recommendation for each of those 3 areas, but I would encourage individual review of the written document because all the recommendations are seen as vital to the complete modernization of the behavioral health system in Kansas. So getting started, under the workforce topic, the number 1 recommendation was a recommendation that the alignment of all master's level behavioral health clinicians' supervision requirements be leveled with that of the social work discipline. Last year, the post-degree supervision for clinical level licensure in social work was changed from 4,000 post-degree supervision hours down to 3,000, and that's in keeping with the requirements of our neighboring states. What we found out is that when someone gets their master's degree, whether it's in social work or psychology or counseling and so forth, that in order to get the full independent scope of practice or clinical level license, Kansas was expecting 4,000 supervised hours of that licensed clinician before they could sit for their advanced exam. And it was hurting us for recruitment and retention because surrounding states only required 3,000. So the social work requirement changed last year. We're recommending that all master's level disciplines be moved to 3,000 post-degree supervision hours as well. On the funding and accessibility, the number 1 recommendation was that the state actively pursue certified community behavioral health clinic designation for the CMHCs. That would involve the adoption of a Medicaid state plan amendment to allow interested providers to become CCBHC clinics. The advantage of a CCBHC clinic is that they're equipped to provide a comprehensive list of behavioral health services while additionally focusing on physical health or whole person wellness. Again, we have surrounding states that are CCBHC clinic systems, Missouri and Oklahoma specifically. And with the additional federal financial support realized through that designation, they're quite frankly decimating our recruitment and retention of professionals in Kansas, particularly those of us that are along those state lines. We're seeing a pretty heavy migration of Kansas licensed professionals into those states. The CCBHCs, from a service provision standpoint, provide comprehensive wellness assessments, provide robust mobile clinical crisis intervention, use multiple evidence-based practices such as assertive community treatment and medication-assisted treatment for opioid abuse, as well as community-based care for veterans. The certified clinics are data-driven, and their performance is monitored by patient outcomes and not service volumes. So in evaluating the scope and breadth of the services, the data-driven nature of the certified clinics, we feel that is the best opportunity to impact the mental health system in Kansas. The final category that I'll touch on is community engagement. And you'll see from the testimony that crisis intervention centers rose to the top there. We've got issues in management of census of state hospitals, and we certainly want better outcomes at the community-based level for the patients that we serve. So the recommendation there is to utilize state funds to support the expansion of crisis intervention centers around the state. I believe there are 4 that are operating right now. The lottery vending machine proceeds are fully allocated to fund the current crisis centers, requiring additional state investment to expand or develop centers in rural and frontier areas. So those are the highlights of the top 3 recommendations that we have, and I'll stand for questions when appropriate.
Are there any questions for Greg? Representative Wolfmore.
Thank you, Mr. Chair. So in a nutshell, the CCBHCs allow these community mental health centers to pull down more federal funds so that they have greater funding available. Is that sort of at the end of the day what they do?
Yes, correct.
And that's similar to what the Excellence in Mental Health a few years back that I think Missouri got and we didn't.
Yes, Excellence in Mental Health Act was the federal initiative, and that's exactly the model. You're right.
So this is our chance to, when we didn't take advantage of that before, to take advantage of that now on a state level, but correct?
Yes, what's happened is SAMHSA has opened up some capacity building grants, and that grant money will allow centers to essentially establish programming so that they are that CCBHC lookalike, if you will, and then only through a state plan amendment or 1115B waiver amendment can the clinic actually operate like an FQHC and pull down that extra federal money. So Fort County Mental Health Center was fortunate enough to be a grant recipient last year. We found out last week that there are 5 additional mental health centers in the state that just got awarded SAMHSA capacity building grants. So there's a total of 6 centers in the state of Kansas that are actively working toward developing their system into this model. And there's another round of grants being awarded this summer. So we hope even a few more centers can have that opportunity.
But these only, those grants are for 2 years. This would allow it to be an ongoing process, correct?
Exactly. Yeah, these are capacity building grants, and once those grants are done, then we either continue with the CCBHC model or we'll have to make adjustments without the grant money.
And I think that Chairman Landwehr could probably tell us, but I know they had a hearing in their committee, and I don't know if you've worked it yet or when you are, but thank you very much. You can probably get us up to date.
Actually, and the next individual is Representative Landwehr.
I didn't know I was on, but that's all right. No, this was really pretty exciting. We actually kicked that bill out yesterday. We did change the start date from July 1 of this year to May of next year. and we wanted to make sure it stayed within the fiscal year so that it gets relooked at in January. That gives KDHE plenty of time to get the 1115 waiver, which is going to be required. So we've got a few more steps than if we'd taken advantage of this a few years ago, it would have been easier. And we were very excited to find out on Friday that we were getting those 5 grants out there. So actually, Fort County, Greg's going to be way ahead of us, but we're going to be able to learn from him and not have to reinvent a wheel. But it's a very exciting, I think, opportunity for us because it puts us more on the level of a cost ratio like our FQHCs are currently done, and that will help a lot in the mental health side of it. So that bill is, in fact, my vice chair just handed me the bill brief to go over this morning as I came down.
Any other further questions for Greg? All right, seeing none, thank you for being here.
Thank you.
The next individual that I have in regards to the Kansas Mental Health Modernization and Reform is Rachel Marsh with the Children's Alliance of Kansas.
Good morning, Chairman Waymaster and members of the committee. Thank you for allowing me to be here today to present the working group results from the Prevention and Treatment Working Group. We had 3 topics: prevention and education, treatment and recovery, and special populations. And I'm going to take the opposite approach of Greg, and instead of highlighting one, I'm going to go over all of the recommendations, but very briefly, so at least you've heard the issues before. Under the prevention and education subtopic, our group really talked a lot about looking at the behavioral health needs of Kansans from a perspective of those who are at increased risk of poor outcomes that we know of, and that we can do things in advance to reduce their risk and reduce the severity of their symptoms. One of the areas, as you know, that is a very concern to Kansans right now is the suicide epidemic. So our first recommendation under prevention and education will require funding of the 988 suicide prevention lifeline. We know that KDOW's just recently, even since this conversation of this committee, received some support to move forward with this lifeline. But in order to make sure that Kansas providers can answer that lifeline so that Kansas residents who need immediate connection to supports in their community, we want Kansas providers to answer so they can make those local referrals based on local knowledge. And that will require funding. Our committee recommended that Kansas should collect fees via phone bills to support increasing the in-state answer rate for the Suicide 988 Lifeline. The second recommendation under prevention and education is increasing access to early childhood mental health services by including language in the Medicaid state plan that will explicitly cover the cost of early childhood mental health screening, assessment, and treatment. Early identification of behavioral health symptoms can allow for earlier intervention and lead to better outcomes for youth. Additional funds would be needed to continue and expand the work statewide, which was started with a SAMHSA Symptoms of Care System of Care grant, Symptoms and Systems. The third recommendation for our working group on this topic of prevention was looking at coordinating a cabinet level position to look at behavioral health that would report directly to the governor. Responsibilities of this position would ensure coordination across state agencies, across public and partners, and support coordination of the various federal and state funding streams to ensure that we're leveraging our dollars in the most effective ways for behavioral health services in Kansas. The final recommendation under the prevention and education aspect of our working group was to look at prevention generally. In Kansas, we have focused most of our funds on treatment and intervention after behavioral health symptoms occur. And our group wants to balance that with the need for prevention so that we can spend some dollars upfront and avoid the problems from occurring or getting worse over time. So that's the prevention and treatment subtopic. And now I'll move on to treatment and recovery. I think you'll see in the treatment and recovery one primary theme, which is to expand our array of behavioral health services. We want to be able to provide behavioral health care in the place that is most effective, using the method that is most effective, and that will meet the needs of Kansans where they are. We need to make sure that we are addressing the suicide epidemic, the crisis stabilization need, inpatient, inpatient services, outpatient services, and utilizing the full array of what we're learning so that we can meet the needs of Kansas with mental health and substance use treatment needs. Of other aspects under the treatment and recovery recommendations were continued focus on the RTF access and wait list, which has been underway, and we're seeing signs of success. We also want to continue and potentially expand our frontline capacity of pediatricians, family physicians, and OBGYNs to be able to know more about behavioral health and have access to supports and referrals. And finally, housing is a really key issue for the working group in terms of treatment. We know that we will see better results for behavioral health care with individuals that have stable and supported housing. So I timed myself so I wouldn't go over. And what you'll find out, and that's actually, okay, I think the last part of our special populations committee, it really is looking at our modernized vision of healthcare. We'll look at communities of higher risk and ensure that we're expanding our service array to meet the needs of those unique communities, such as domestic violence survivors, crossover youth, or persons who need the IDD waiver. So I am happy to stand for questions at the appropriate time on this for this working group. Thank you.
Well, thank you, Rachel, for being here, and thank you for being prudent on actually timing yourself on your testimony. I have to give you credit for that. Committee, are there any questions for Rachel? Representative Williams.
Thank you, Mr. Chair. Rachel, in terms of the funding for the Suicide Prevention Life, can you explain or elaborate a little bit about what that cell cost funding would be? Or is it just generic, or did I misunderstand?
Representative, that is an excellent question, and I will confess that I am not familiar specifically with the costs nor the strategy of the collecting fees. In terms of what this was a prior report of a prior committee recommendation, that prior committee really looked at that. What our working group did was revisit that and continue to say that this is a priority for our working group. So I would have to defer to probably KDADS in the future, or others who may be more familiar on the specific costs.
And so, Mr. Chairman, I would just recommend to the group to maybe the funding needs to be found somewhere, but Kansas ranks number 6 in the nation for the highest fees and taxes on cell phones. And if you combine state and federal, it's over 26% of your cell phone bill is fees and taxes. So though it's a very good idea, I think it's not necessarily relevant today, but something to look at. How can we fund some of these initiatives instead of being perhaps generic, looking really at the best places? Thank you, Mr. Chairman.
Any further questions for Rachel? All right, seeing none, thank you again for being here today.
Thanks.
The next individual that I have is Andrea Clark with the Kansas Department of Aging and Disability Services. Andrea.
Good morning. Can everyone hear me okay?
We can hear you, yes.
Great, thank you. Well, thank you for the opportunity to share our work with the committee. As mentioned, my name is Andrea Clark, and I am the CIT and Veterans Program Coordinator and the Behavioral Health Commission at KDADS. I had the honor to serve as co-chair for this group, along with Mr. Kessler from the Association of Kansas Community Mental Health Centers. So the first topic addressed by the System Capacity and Transformation Work Group was data systems. We looked at a modern behavioral health system requiring what we would consider seamless, real-time data systems with multi-directional data sharing among behavioral health providers, other healthcare providers and systems, community organizations, social service providers, law enforcement, and payers. A modern system would provide useful, easy to access and analyze information from a systems level so that both stakeholders and decision makers can get an accurate snapshot of how the system is functioning and where to direct resources and policy change. And then at the micro level, a modern system also provides for the efficient and secure exchange of personal health information so that we can facilitate the best care for Kansans possible. So with this in mind, we identified 4 recommendations for immediate action and 1 for strategic importance. First, we recommended the continued support of a new state hospital electronic health record. This is a project that KDADS has already issued an RFP for or is working on, and the work group recognized the need for continued support of this as an infrastructure development. We also endorsed legislation that we return the survey process of certain surveys like the Kansas Communities That Care survey and the Youth Risk Behavior Surveillance System, which are conducted in schools, for example, that process returns to an informed opt-out consent for parents to improve better and more meaningful data collection of those tools. The third recommendation related to data systems was that the state look at utilizing Medicaid funds to incentivize participation in health information exchanges like KHIN or the Lacey network. The fourth recommendation around data systems we discussed was the need for a statewide needs assessment regarding substance use disorder in the state. And finally, for strategic importance of data systems, the work group highlighted a recommendation that state agencies need to develop policies that really improve cross-agency data sharing, making it so that service and program decisions are based on shared needs assessments. The next topic the work group addressed was interactions with the legal system and law enforcement. The vision of the work group was that a modern behavioral health system allows for timely connection to services for those in crisis that are in the least restrictive setting, but is still appropriate to ensure public safety. A modern approach increases access to treatment resources for those that are justice involved and also provides training to law enforcement, courts, and the legal system to increase awareness of mental health issues and provide the tools for appropriate responses. Again, we identified 4 recommendations on this topic, 3 which we highlighted for immediate action and 1 for long-term strategic importance. We recommended expanded training to include correctional facilities to better recognize substance use disorder and trauma-informed approach. The next recommendation we made was for the work group recommended developing a process to monitor the implementation and status of the recommendations made by the Criminal Justice Reform Commission addressing behavioral health. We wanted to recognize the significant work done there as well. And as this is a living document, continue to align the priorities of both. The next recommendation that the work group made was we discussed increasing the utilization of evidence-based substance use disorder referral for those with law enforcement contact. This is really to highlight the high incidence of substance use disorder amongst those who are justice involved. And again, part of this is recognizing the importance of the work the Criminal Justice Reform Commission had previously done as well, since that report hadn't been released or completed by the time that we had collected the reports that we reviewed in this work group. And then finally, for strategic importance, we also recommended that an operational definition of crossover youth include behavioral health in the definition. Just recognize the importance of behavioral health needs for our children that have concurrent involvement with the child welfare and juvenile justice systems. The last topic that we examined was systems transformation. This topic was really address strategies that would transform the continuum of care to ensure an integrated and coordinated approach to care delivery. Discussion around system transformation focused really on barriers related to cross-system collaboration, infrastructure changes, and Medicaid payments for services to families. The working group advanced a total of 5 recommendations, 3 for immediate action and 2 for strategic importance. First, the work group recommended looking at a regional model to supplement traditional state hospital settings with regionalized facilities that would accept both voluntary and involuntary admissions for persons in need of acute services, as well as longer-term specialized care. This could be accomplished through a combined approach of state institutional alternatives, a policy which KDADS is currently pursuing, as well as supporting smaller regional state facilities. The next recommendation that the work group made was regarding reform for nursing facilities for mental health. This recommendation was a high priority to the working group due to the importance of protecting the rights of citizens with disabilities and providing Kansans the opportunity to live and receive care in the least constrictive environment possible. The next recommendation was focusing on integration. So really increasing integration, collaboration, and care transition linkages between mental health, substance abuse, primary care, and emergency departments across the state. Integration in this sense was highlighted across several of the reports and the topics reviewed by the work group, and is really a major driver behind many of the recommendations previously proposed. And then finally, of strategic importance, the work group recommended that Kansas should continue the expansion and support of evidence-based practices in the state. This includes both housing and supported employment programs, and that the same evidence-based programming should be utilized across all systems, including justice systems, substance use disorder treatment services, and mental health services. And finally, the working group also advanced a recommendation to enable the utilization of certain Medicaid procedure codes as a tool to support youth in foster care, and as well as any child accessing care in a psychiatric residential treatment facility that would allow for the ability to bill for services provided to a family when or to a parent when the child is not present. So that concludes shortly our recommendations, and I'm happy to stand for questions when appropriate.
Thank you, Andrea. Representative Wolfmore.
Thank you very much. I just want to pull out a couple of those and maybe get a little more information. It's a lot of information today, and we've got to try and implement a few of those. So my first question is, we've heard about these regional hospitals for a long time now. I think we've bandied that about for several years. Do you know if there's been any progress or where we are? I've kind of lost track of it.
I don't believe that there is anything specifically related to or progress related to standalone regional hospitals. There is the KDADS and KDHE have been working on what they call a state institute alternative policy, which allows for the state to contract with already existing facilities, right. and that policy is currently being worked on and preparing for implementation. So I think the work group's recommendations was really wanting to look at an approach that has multiple solutions to the problem, and not just focusing solely on one proposal or the other, but that we really need many tools to be able to address the needs of Kansans in crisis.
And then
you may.
And then nursing homes for mental. I don't know why I'm echoing.
Andrea, you might have the volume on. There's some back feed that's coming on.
And then you mentioned nursing homes for mental health, and I know we don't have very many of those around the state, and you tell me it doesn't appear that we have sufficient numbers to provide for the need for people. So what was your recommendation around that specifically?
Andrea?
Yes, the recommendation for around nursing facilities for mental health was really looking at not necessarily the number, but the continuum of care of services that are provided to ensure that there is active treatment services being given to residents so that they are able to eventually move back into the community. The recommendation is really also around making sure that community-based services are available. And what the work group recognized was sometimes the inability to discharge individuals from a nursing facility for mental health creates kind of upstream pressure on the crisis sitter, because we can't get people into the community-based services they need. Therefore, they stay longer in a long-term care facility, which then limits the number of people being able to be admitted. So I don't know that the work group made a recommendation specific to number of beds being available, but just ensuring that we're providing the best care possible so that folks can get back to really the most, the least restrictive environment for them. So.
Representative Wolfmore, your mic is off.
I'm sorry. I think there's something in the governor's budget that helps with that issue, but I'll have to look at that and refresh myself on it. Thank you very much.
Any further questions for Andrea? All right, not seeing any. Thank you for being here today. The next individual that I have is Sandra Berg with the United Behavioral Health. Sandra?
Good morning, Mr. Chairman and committee. I'm Dr. Sandra Berg. I'm the Behavioral Health Director for United Healthcare, and I served on the sub-work group for telehealth. We had 5 recommendations out of our work group, and these were based on the crisis that we're in right now with the pandemic and the need to shift quickly to telehealth, and also because across the other work groups, we saw the need for telehealth continue to crop up, and so we wanted to address it in a separate sub-work group. Because of the pandemic and the need to shift quickly to services being provided to our most vulnerable populations, telehealth was quickly implemented. And because of that, we were able to see some of the opportunities we have around telehealth, as well as some of the areas that we needed to focus on to improve the delivery of care across Kansas. The work group, the first recommendation was around quality assurance. We wanted to make sure that the delivery of services met a high standard for privacy, that we had guidelines and education for those delivering the telehealth services, that we were collaborating with licensing and regulatory agencies and meeting the requirements for those licensed in Kansas to provide telehealth. We also looked at allowing supervision to be delivered through telehealth for those that are going for licensure in Kansas, and then allowing services to be provided flexibly when there was broadband access limitations. The second recommendation was around reimbursement codes. During the pandemic, we saw a significant expansion of service codes that were allowed to be delivered through telehealth. The recommendation from the work group was that we would maintain some of the newly added codes during the pandemic, and this would allow people to receive services in their home, which has led to a lot wider utilization of telehealth codes. Prior to the pandemic, only approved sites in an office could be the site for accessing telehealth service, but following the pandemic implementation, we were allowed to have telehealth services provided in people's homes in other settings. The downstream effect of that was the origination fee that the facilities could collect was not being collected at the time. So there was a decrease in the revenue from that. Telehealth services for crisis was our third recommendation. Crisis services through telehealth would assist law enforcement and expand access to those services, connecting them with local mental health professionals. Having immediate access to trained professionals would also help generate savings by resolving crisis prior to a psychiatric admission. The fourth recommendation was around the originating and distant sites. As I alluded to before, the originating site was a barrier in receiving telehealth services because you had to travel to a designated office to get your telehealth services from somebody in an office. The recommendation from the committee was to broaden the definition of originating site that was consistent with the Kansas Telemedicine Act. This again allows consumers to have broader access to services in their home and allow for privacy standards based on the quality assurance that we alluded to in the first recommendation. There was also a recommendation to explore providers' ability to practice across state lines and allow consumers to receive services through interstate licensure compacts. The fifth and last recommendation was for child welfare system and telehealth. And this was to utilize telehealth to maintain service and provider continuity, especially for our children in foster care who are frequently disrupted, moved, and not maintaining a consistent treatment team when they are moving around because of the location where they're at. So those were the 5 recommendations from the Telehealth Committee, and I will stand for questions.
All right, thank you. Committee, any questions? I'm not seeing any. Thank you for being here today.
You're welcome.
That is the conclusion for our mental health modernization and reform reports. We are going to now move to higher education budget committee reports. We'll give the chairman a few minutes here. I think he'll be returning here in a few minutes. If you guys want to go ahead and get out the your books for that, and Chairman Humphreys can get ready to present. I think she'll tell you what page.
Okay, and thank you, Vice Chair, for filling in for me for a little bit. We're going to go ahead and move on to the budget recommendations from the Higher Education Budget Committee. Actually, we're planning on having some budget recommendations from the General Government Budget Committee, but those have been pushed back a day. So I will turn it over to Representative Humphreys in regards to the budget. I believe we're starting off with the Behavioral Sciences Regulatory Board. The one thing I would like to say up front is this is a little bit different than in previous years where we had the signatures from the committee members of the Budget Committee. They're not gathering the signatures, but if there is any individual on the committee that does not agree with some of the budget recommendations from the Budget Committee, there is a statement, and I don't know if Representative Humphreys wants to elaborate on this, but I did have a note that Representative Burris has communicated that he does not believe the following budgets are ready for presentation to the House Appropriations Committee, and that includes the Behavioral Sciences Regulatory Board, Kansas Board of Healing Arts, Kansas State Library, and the Kansas State Historical Society. So if you could elaborate, or if you can, on that statement.
I would just agree that was the statement, and I don't know that he disagreed with the recommendations. I think it had to do with the procedure is what it was about.
What was the procedure?
Just he felt like they weren't quite ready yet. I think that's okay. Let me confer with Shirley if you hang on just 1 second.
All right, thank you.
Okay. I can actually read a statement from him. I do not believe the House Higher Education Budget Committee was able to sufficiently review the budgets of the above referenced agencies. I therefore do not believe the reports are ready to be presented to the Appropriations Committee and consequently decline to sign the reports.
And was there any discussion as to why they're not ready?
I think it's a time constraint. You know, we only have so much time to do each one, and we move on. So
You did have hearings.
Oh, absolutely.
Okay. All right. So I just wanted to make sure that everybody was aware of the comment that was made by one of the members on your committee.
And I think if I could just say, Mr. Chairman, that if someone disagrees with the recommendations, they can do a minority report. So he wasn't disagreeing with the recommendations, but rather he sent a letter that we didn't have time to sufficiently review them. There's a little bit difference in the new procedure that we're doing it. From what I understand, I'm new to this too, so
and I understand that, and
I
I wanted to let the members know that as well, that this is Chairperson Humphrey's first time of reporting budgets out. So I guess be somewhat nice when you have some questions. But when was the hearing held on these budgets? Do you know?
It was last week, Tuesday and Wednesday, and then we did recommendations on Thursday. We did these two, the two fee-funded agencies that I'm going to report on Tuesday. We did the library and the Historical Society on Wednesday, and then we did recommendations on Thursday.
So in the standard course of time, there was sufficient time in regards to the hearing as to working the bills or the budgets?
I would think so. I have nothing to compare it to. This is all I know. And so it seemed fine. I mean, did every single question get asked? No, we had to finish at 3 o'clock because another committee was coming in. But it seemed, I signed theoretically, and so I thought it was sufficient myself. But yeah.
Okay. Well, thank you. We'll go ahead and move on to the first budget. Chairperson Humphreys.
Yes.
I believe it's volume 3, page 1591.
Oh, thank you so much for pointing that out. Okay, so we're going to look at the Behavioral Sciences Regulatory Board that we'll call the BSRB. It's a licensing agency for most of the state's mental health professionals. It is completely fee-funded, and we are doing 3 years, FY 21, 22, and 23. As far as FY 21, the agency estimated expenditures of $959,271, all from the fee funds or special revenue funds. That's the same amount that was approved by the 2020 Legislature. With the revised estimate, the agency decreased salary and wages expenditures, but it was offset by increased expenditures for contractual services. That was $35 both ways. And the governor concurred with the agency's budget for 2021, and the budget committee concurred with the governor's recommendation. So that's the BSRB for 21, FY 21. I can take questions for that year or move on to 22.
Why don't you just go ahead and move on to 2022 and then also 2023?
Okay, great. Okay, so the agency requested expenditures of $959,145, all from their fee funds, or also called special revenue funds. It's a decrease of $126 below the revised estimate of 21. The governor concurred with the agency's request, and the budget committee concurred with the governor's recommendations. Basically, salary and wages went up a little bit, contractual services and commodities went down, and capital outlay went up, and it equaled out except for $126. Okay, FY 23. The agency requested expenditures of $968,062, all from, again, the fee funds. It's an increase of $8,917. The increase is attributable to increased expenditures for group health insurance, building rent, and office equipment. They have 9 FTEs, by the way. I didn't mention that. And the governor concurred with the agency's request, and our committee concurred with the governor's recommendations. And that is the BSRB.
Okay, so in 2022, we saw a reduction of $126. And then in 2023, we're seeing an increase of almost $9,000.
Yes, and it has to do with expected increase in health insurance. So salary and wages were up around $4,000, contractual fees up almost $3,000, commodities about $500, and capital expenses $1,500. That's how the basically almost $9,000 plays out.
Committee, any questions for Representative Humphreys? Representative Williams.
Yes, thank you, Mr. Chair. So in light of what we just heard today about the Special Committee on Mental Health and Modernization and Reform, how will that impact this budget going forward?
So it really won't. This agency is only, it's licensing for the mental health professionals. So that's what they do, is they do the licensing for all kinds of, every mental health profession you can imagine.
Will it affect the criteria for licensing? For example, the social workers change those qualifications? I'm getting a no, so.
I'm getting a no too, so I don't think so from the
Okay,
experts.
thank you. Good job, by the way.
Thank you.
Committee, any further questions for Chairperson Humphreys? All right, not seeing any. Is there a motion?
Yes, Mr. Chairman, I move that the appropriation, that we,
Recommendation.
say that again?
Budget recommendation?
The budget recommendation for the Behavioral Sciences Regulatory Board passes out favorably, or not passes out, is approved by the Appropriations Committee.
Be approved for 21, 22, and 23.
Yes.
Seconded by Representative Wolfmore. All those in favor say aye. Opposed? All right, motion passes. Chairperson Humphreys.
Okay, thank you so much. The next entity we will look at is the Kansas State Board of Healing Arts. And that is a similar entity, except it's the licensing agency for medical doctors. It's not nursing, dentist, or mental health, but it's all the doctor licensing besides that. They have 62 FTEs. And we will be again looking at 21, 22, and 23 because it is a completely fee-funded agency.
Just to let everybody know, this is in Volume 3, page 1697. You may proceed.
Thank you. So for FY 2021, the agency requests a revised estimate of $6.5 million, all from their special revenue funds, which again are their fee funds. There are no changes from the FY 2021 approved account. Again, there's 62 FTE positions. The governor recommended expenditures of $6.5 million. It's an increase of $21,742, and that is due to coronavirus relief fund for laptop computers and other equipment for teleworking, and so that was added. So the governor's recommendation is $21,742 more. And the Budget Committee concurred with the governor's recommendations for FY 2021.
Did they not already have laptops provided?
I think it was just, I think they had laptops, but they have 62 FTEs, so I'm sure it was just a little bit extra.
Okay. Any other questions in regards to fiscal year 2021? Seeing none, you may move on to 2022.
Okay. Okay, FY 2022. The agency requested, again, $6.5 million, all from the fee funds. It's an increase of $58,848, which is almost 1% above the revised FY 2021 estimate. The increase is attributable to increased expenditures in salaries and wage fringe benefits, health insurance, et cetera, and capital outlay. The governor concurs with that budget, except the governor also included the transfer of $75,000 to the Kansas Board of Pharmacy for K-Tracks. And I'm assuming y'all may have questions on that, which I can answer. But the Budget Committee concurred with the governor's recommendations, and we had the following recommendation, that the committee recommends that the agency provides a breakdown of the total FTE by department, such as licensing, disciplinary, litigation, IT, et cetera, for future budget hearings. They have 62 FTE positions, and we would like to have known which or how many employees were used for each of those categories. So that was our notation, and that is FY 2022. I'll move on to 2023 and then answer questions.
Well, and I see
Okay,
that the same transfer of $75,000 is in 2022 and also in 2023.
Yes.
Has that not been a regular transfer in the past for
So
K-Tracks?
from what I understand is it varies because The federal grant varies. And so there's times when a lot of the agencies have contributed to K-Trax, but this 2 years, 2 agencies will be contributing $75,000, and the Kansas State Board of Healing Arts is one of those 2. So it's varied through the years since we passed K-Trax.
And I'm sure it's in the budget book, but I'm just wondering how much the transfer was in the past from the Kansas State Board of Healing Arts.
Okay, hang on. So, Mr. Chairman, just for the healing arts piece, last year was $200,000 transfer that the governor recommended, but the legislature removed all of the transfers.
Okay, and then I think Representative Kincannon wishes to elaborate.
Great, good.
Well, I had a question. I was going to ask what the discussion was in your committee. We had this same discussion yesterday in social services budget with the Board of Nursing. Mm-hmm. So there's actually 3. That's Board of Pharmacy, Board of Nursing, and Board of Healing Arts that contribute. This started out entirely a federal grant. Mm-hmm. And as the grant wound down, the people who contribute to it didn't want to see it. They realized the benefit to the state and didn't want to see it go away. So that until we found out a way to fund it, they were willing to contribute to keep it going. But I think our discussion last year, and my discussion will be this year, is that the people who we are asking and may someday require to use it should not be the people who are funding it. It's a public health problem, and it should be paid by SGF. And anyway, those are the comments I made in committee. I was wondering what...
That's helpful. And I said 2 agencies because they're contributing to the pharmacy board.
Yeah.
Which, so that one, they're paying it.
Yeah.
And then 2 extra ones are paying this year $75,000 for it.
Yeah, you're right.
Yeah.
They're just, Board of Pharmacy just houses it.
Yes. And our discussion in committee was that we need to figure out something permanent for this, like how are we going to fund K-Trax?
Right, and last year, we funded it and gave them the direction, find some funding. And, the thought then was that they would look for some type of federal funding or some grant money, but to turn around and say that we're going to take private donations that will be tax deductible. Did you hear that?
Oh, we didn't hear that.
Yeah, that was one of the Board of Pharmacy. We had Board of Pharmacy and Board of Nursing yesterday. And yeah, that they want tax deductible donations and that there would be contributions again. And I think that does not solve the problem that we were trying to solve. Mm-hmm. So anyway, I appreciate your conversation.
No, I appreciate your comments. Thank you so much.
Representative Ballard.
Well, I was going to make the comment that Representative Kincannon made. The only thing I will add to that is that I asked the question about how did they feel about that. And she said because they believed in K-Trax and they wanted to, that they, they didn't begrudge the fact they had to pay it, but that because they had money now, where in previous years they didn't have that money. But the bottom line was they don't feel that they should be always put on the spot when everyone benefits from doing this as well. But we put that to them by saying find other funding agencies. They were able to get 2 of their grants that were 1-year grants renewed.
Right.
Again this year, then they got another grant renewed. So they're out really doing kind of what we want them to do by getting their grants. And even though they're specific, they're able to make it work. But my comment was yesterday, and I'll make it today, that this is something that benefits the whole state. And I think we're going to either have to step up to the plate and help them more, because they can't do it all through grants. But they're doing their part. Every year, they're bringing in new monies, and they're hustling in order to get it done. And I think you found that out yesterday as well, right?
Yes,
And
thank
I
you.
comment really because my chairman is not here, and I know he would comment on that because he has been very diligent about watching that as well.
Yes,
Well-
I agree. Thank you for those comments.
Well, I'll just say that we had a discussion on this during the interim in the Joint Legislative Budget Committee in regards to the funding of K-Trax. And this will obviously be something we'll probably elaborate on later on as we go through the budgets of the other agencies and departments that fund it. And actually, Chairman Carpenter and I had a conversation in regards, I believe, does he not have a bill that would change the funding of K-Trax and coming from the State General Fund? I believe he does have a bill that's been introduced. Yes.
Thank you. He hasn't said anything about that, but he did make the comment that he has maybe a solution, so maybe that's what he's referring to.
Yeah, I believe there's a bill introduced, and we had a conversation about that in November. And at that time, I mean, Shirley, you may correct me if I'm wrong, but it'll be changing the funding mechanism for K-Trax, because as it's set right now, it can't come from State General Fund. And this would alter that funding piece. Is that correct? Okay.
Because I think one of the things that Alexandra Blasi, who's the executive director, was pleased about is that the governor had funded an inspector position. So they're going to get a new position that's going to help them do the work that they have to do along those lines. But yes, they do need our help. And well, when we present our report, you'll find out, some of the good work that they continue to do.
Any further questions or comments in regards to fiscal year 2022? Representative Hoffman.
Thank you. Thank you, Mr. Chairman. So would we want to set this aside? Would we want to set this aside, this 75,000, and talk about it later if we're going to have another option, or do we want to?
I would probably say not.
Okay.
Because of the fact that, one, we don't know what's going to happen with the bill that's been introduced. And also, there are other mechanisms as far as funding K-Trax with other agencies and departments for the funding of K-Trax. And so I would probably say we don't need to do that at this point. If we need to make alterations later when we're working the budget, we'll do that at the time. But as for right now, I would probably say just let it go as the way it is from the Budget Committee.
Okay, thank you.
Any further questions or comments? All right, seeing none, 2023.
Okay, we'll go to fiscal year 2023. Again, we're still on the Kansas State Board of Healing Arts. The agency requests $6.9 million from all from special revenue funds. Again, it's their fee funds. This is an increase of $373,908, or 5.7% above their fiscal year 2022 request. The increase is primarily attributable to increased expenditures for computer processing equipment and software. Again, the K-Trax transfer is in there on the governor's recommendations. The Budget Committee concurred with the governor's recommendations, and we had the same notation at the end, just that we would like a breakdown of the 62 FTEs, what their actual positions entail. And that's fiscal year 2023. I'll stand for questions.
All right, thank you, Chairperson Humphreys. Representative Sutton.
Thank you, Mr. Chairman. Madam Chairman, on the increased expenditures for computer processing equipment and software, was that brought about through OITS, or are they operating on a rogue independent system?
Good question. I will say that piece of it was $315,650 for software and computer upgrades, but let me ask that in particular.
Sure.
So that is part of the grant for the K-Track system to help pay for that.
Okay, so that's K-Track's software that we're talking about.
Yes, it is.
Excellent, thank you. Thank you, Mr. Chair.
Representative Prahl.
Thank you, Mr. Chairman. I hate to beat the good horse to death where we've been talking about K-Tracks. I don't recall what the total cost of that is. Does anyone have that?
Shirley?
Shirley doesn't know, nobody knows.
Okay. That's all right. Thank you.
Right now, find out. Okay. It's in the pharmacy budget, and so we don't happen to have it right now with us, but of course we can find it.
Thank you, Mr. Chairman.
We can definitely get
yeah.
a finite number in regards to how much the cost of K-Trax is annually. Representative Kincannon was guessing anywhere about $300,000 for the K-Trax program. But obviously we can come back and revisit that number later on. Any other questions for Chairperson Humphreys? Seeing none, Chairperson Humphreys.
Mr. Chairman, I move that that the Higher Ed Budget Committee puts forth a State Board of Healing Arts budget, and that it be, and we recommend it to be approved by the Appropriations Committee.
Committee, you've heard the motion. Is there a second? Second by Representative Prahl. All those in favor say aye. Opposed? All right, motion passes. Chairperson Humphreys.
Thank you, Mr. Chairman. Committee, now we will look at the State Library, and I think Mr. Chairman will tell us which book and what page it's on.
And you're on the State Library?
Yes, State Library.
That is Volume 2, page 896.
Thank you.
Actually, the next budget after that with the Historical Society is also in Volume 2.
Hi, Norma. Okay, committee. Again, we're at the State Library. We will be looking at fiscal year 2021 and fiscal year 2022. For 2021, the agency requests a revised estimate of $5.9 million. $3.9 million of that is from the State General Fund. That is an all funds decrease of $752,017 and an SGF decrease of $720,420, or 15% below the amount approved by the 2020 legislature. The decrease is primarily attributable to the agency's request that the agency reappropriate the reappropriations totaling $740,000 in FY 2021 be lapsed. So the agency has 31 FTEs. That is one extra position. They're requesting a library consultant, one more position for library consultant. And the governor concurs with that, the agency's revised estimate, and our committee concurred with the governor's recommendation. I might just, out of interest, if the State General Fund is about 2/3 of the budget, and federal funds are the other third. It's a Library Services Technology Act. They did have an allotment in 2020 of $19,538.
In 2020 or 2021? Might have been fiscal year 2021. 21?
Yeah.
All right.
Fiscal year, yeah.
Any questions in regards to 2021? Representative Estes.
Do you have a sense of how COVID is impacting their use, increase, decrease?
They talked about that quite a bit, just that they really went on a very constrained, what they were able to do. They did traveling, and they did, and just the way the libraries were operating, a lot of things were shut down. Therefore, that's the decrease of $720,000 had to do with some of those things. So it did affect, yeah.
Representative Hoffman.
Thank you, Mr. Chairman. So the extra, or the new library consultant, they've already filled that. It looks like, did they fill it in July or?
I don't think it is filled. I think it's, hang on. Yeah, so they are seeking to fill it still.
And they're planning to have it filled before the fiscal year ends?
Yes.
And they've got the money to pay. Did they give you any sort of an idea how much that was going to be for the new person?
I think we talked about
Because you were talking
that.
probably at the most.
Just a few months.
A couple
Yeah.
months.
Right. So appropriated and not filled, is that what you're thinking? Okay, so actually, Representative Hoffman, they have several positions that are unfilled. One of them is an IT position that they've had trouble finding anyone for 6 months. And so they're going to fill that one first, then the library consultants. But they're probably in the range of right now 25 FTEs actually filled, and they're trying to fill the other ones.
Well, then why do they need one extra over what was approved? Because we approved 30 last year.
It's a great question. We did ask that question.
Okay.
I mean, we didn't, I'll be honest, it wasn't a satisfactory answer.
Really? Okay, let me think about it a little bit.
Okay, do, please. That'd be great.
So in regards to that, what is a library consultant? That is the increased position.
Okay, that's good. Okay, so it's a general term that they use for reference librarians, a talking book specialist. It's a general term they use for lots of their their employees.
This is an increased position, not one that is vacant.
No, there's one, yes, there's one increased position. They have had 30 and they're 131. It's one increase.
Well, we'll probably discuss this later when we
Good.
actually do the budget.
Okay.
Any other further questions in regards to the state library for 2021? I have some other comments, but I'm going to reserve those until we talk about 2022.
Okay.
So just to prepare yourself.
Okay. Okay, FY 2022 for the state library. The agency requests operating expenditures of $5.8 million, including a 3.9 in SGF, and the rest is federal funds. That's about 2/3 to 1/3. That is an all funds decrease of $34,000 and an SGF increase of $2,994. The decrease is attributable to the ending of a market strategy in Western Kansas that was completed in 2021. The agency requests, again, 31 FTE positions, which is the same number that we just talked about. The governor recommends operating expenditures of $5.8 million, including 3.9 in SGF. That is a decrease of $4,000. The decrease reflects the partial acceptance of the agency's reduced resources budget for contractual services. So they submitted their reduced resources budget, and they submitted 10%, and the governor, which would have been $393,000, the governor reduced it $4,000, attributed just $4,000 of it. And the budget committee concurred with the governor's recommendations.
Okay, so when we're looking at the budget for fiscal year 2022, there was a 10% allotment in regards to this budget. And it says here that the reduction would be to the talking books outreach, eliminating travel mileage reimbursement, reducing professional organizational fees, eliminating recovery payments to the Kansas Library Express Courier System, and reducing upcoming subscription and dues renewals.
That was the 19,000.
19,
Yeah.
the 10% allotment that the department was requested by the governor. Correct?
Okay. So are you referring to that 10% reduced resources, not the allotment?
It says, yes, it'd be the 10%
Reduced resources.
Yes.
Mhm.
The question I was going to ask, and I doubt this was probably brought up, but I know Representative Kincannon, myself, and I'm trying to think if there's anybody else, in 2019, I believe it was in October of 2019, we traveled to the state of North Carolina, and we did a tour in Charlotte and the communities around Charlotte, North Carolina, in regards to children's education and children's health. And one of the things that was brought up quite a bit, and in fact, I think it was the first stop that we had, was a partnership that an organization had with the Dolly Parton Imagination Library. And I'm aware of this program because in our area of the state, and Representative Kincannon can attest to this, we have the Dane Jean Hansen Foundation that actually funds the Dolly Parton Imagination Library for any child that is born in the counties that that foundation represents. And so when my son was born, we actually had a form when we were at the Salina Hospital to fill out. And so every month, Christian receives a free book from this library that was set up by Dolly Parton. And I don't know all the detail. I don't remember all the details in North Carolina and how that was actually set up. But I do know statewide there are particular organizations that do fund that, like the Dane Jean Hansen Foundation. But there might be pockets in the state where there is not any service in regards to that particular that organization where they send a book out to every child that is born in the state of Kansas. One question that was brought up is, like when Christian was born, we had to sign up, and one thing was brought up as making it automatic to every child that was born in the state of Kansas. And I know when looking into this, I believe that the cost was about $2 million to make that a statewide program. But if we also have the private foundations that want to fund part of that, but have it opened up to the state, and maybe have a state portion providing that particular project for all children that are born in the state of Kansas, I think that's something that we can look at. And I don't know if that falls in the state library or in something else, but that was just something that we did have quite a bit of a discussion on when we did the tour in North Carolina. And it's something that North Carolina is doing for the betterment of the children that are born in the state of North Carolina.
And was that through their state library? Do you have any idea?
That I don't know. Representative Kincannon, do you recall where that was funded out of?
And the foundation you were speaking of in your county, that's only for children born in your county?
No,
It's
actually,
countywide? No?
the Dane Jean Hansen Foundation represents, Representative Rogers, how many counties do they represent?
37 counties in northwest Kansas, from Salina to the state board. So, yeah, in fact, they have so much money, they do a lot of great things. Yeah. In fact, they're redoing their museum in Logan. You can all come and see it. But
and that's in your district?
Yes.
Yeah, that's what I thought.
Okay, thank you.
Anyway, so yeah, this foundation funds that particular program for every child that is born in those 37 counties. But as I said, the parents have to opt into the program as opposed to just being automatic. But that's something that we can probably, and maybe we even have a presentation on that because what was the former, Representative Kincannon, what was the former governor of North Carolina that spoke to us? Anyways, he was a very staunch advocate for this program. Yeah, and all children's issues. And like I said, I mean, my son receives a new book every single month. And
Until he's how old?
he's 2.
But how, until he is how old, you know?
Is
5.
it 5?
Yeah,
I think until they
awesome.
go to
Great.
school.
Okay,
So.
interesting.
Representative Ballard, did you have a? 5, okay.
Good, okay, something to look into.
Any other questions or comments? Representative Hoffman.
Thank you, Mr. Chairman. And evidently, they must fund the south part too, because my kids got the same thing.
The same foundation?
I don't know if the same foundation, but they, through the Dolly Parton Foundation, they got books. Some of my favorite books to read to them. Going to Sleep on the Farm was my favorite one to sleep.
Noted, thank you.
And like I said, I do know there are other foundations across the state that do fund the Dolly Parton Imagination Library, but there are pockets of the state that do not have that availability. And so I think it might be prudent for us to look at opening that up for the entire state, because obviously it does have the best interest of children's education when they're able to have books received and obviously provided by this particular organization in helping with the children's education.
I don't believe we have it in Sedgwick County that I know of, so that.
And like I said, I'll do some more research on this, and we may have a hearing on the aspects, 1, of the Dolly Parton Imagination Library, 2, the areas of the state that are not committed to receiving that, and then seeing 3, how we could implement that across the state. Representative Hoffman.
Thank you, Mr. Chairman. I'm going to make a motion. I move that we not necessarily set the one position aside, but that we do make a notation to make sure that we look at that before we end up doing the budget. And I'd like the state library to give us more information on why they need another position if they haven't even filled all the positions that they have. If I'm understanding right, you said they have 25 working right now.
Yes.
And it always kind of gets me when we okayed the budget for 30, and then it looks like they turn right around and said we want 31 for the same budget year, and are actively looking for someone for that. So I'm not going to. That would be my motion, just simply for us to look at it before we do the final budget, and that we would get more information in the meantime, either to your committee or to Appropriations.
All right, committee, you heard the motion, seconded by Representative Estes. Any discussion on the motion?
I appreciate it, and I would agree. Thank you.
All right, seeing none, Representative Hoffman, you may close your motion.
I close.
Committee, you've heard the motion. All those in favor say aye.
Aye.
Opposed? Motion passes. We're back on the budget. Representative Ballard.
Thank you, Mr. Chairman. I just want to comment again on Dolly Parton's and our imagination. I'm glad that he's in favor of that, because I think it was 2 years ago when NCSL met in Nashville, Dolly Parton came to present, and she talked about her library and imagination and why she did it. Basically, she did it because her father could not read. And one of the ways before he died, she wanted to honor him, was making it possible for all children to be able to read, and that's how she wanted to spend her funds. And she talked about that, and and at the time we discussed it while we were at the meeting. So I do know that, those of us from Kansas, the speaker included, were in favor of it. And her idea is that by the time they're 5, they will have a library of 60 books. And those books are tapered to the age from young, 2, 3, 4, 5. So as they get older, they have all of that there. So it's a huge educational tool. And I do know there are some places, because I've received 2 emails, that's not very many, but wanting to know how do you get these books, because they know of people in Kansas that have it. So I know there are some pockets there. So I would be in favor of that hearing. And she's basically funding it, really. Yeah, we just do our little part by paying the postage and stuff like that for people. So thank you for bringing it up.
I do know that since the Imagination Library was created, she has increased the literacy rate in the state of Tennessee substantially.
Yes.
And so it does have benefits for children's development. Any other questions or comments in regards to the budgets for the state library? All right, seeing none, Chairperson Humphreys.
Thank you, Mr. Chairman. Committee, I move that the House Appropriations Committee accepts the higher ed budget recommendations for the State Library of Kansas.
As amended.
To be approved, as amended. Thank you.
Committee, you've heard the motion. Is there a second? Second by Representative Wolfmore. All those in favor say aye.
Aye.
Opposed? All right, motion passes. Chairperson Humphreys. And the State Historical Society is in, again, in Volume 2, page 826.
Yes. Yeah. Okay. Okay. Do we know, like, which?
The revenue from pharmacy is the $367,000. Of that, they're asking for the $145 from the healing arts and nursing. That's what pharmacy has to.
So 1.7 total.
Is total, and then.
What this, what's not federal is 367.
And that's what pharmacy has to do. 145, which is.
Okay, Mr. Chairman, if I could go back and answer the question about the K-Trax expense, or would you like to do that later?
Yeah, that's fine. And actually, Representative Kincannon had also provided some information in regards to the total funding of K-Trax, and that was almost 1.2 million in fiscal year 2022 and 1.2 million in fiscal year 2023. So that's the total amount that's funded for K-Trax. But go ahead and elaborate.
Well, and I would just add that most of that is federal funding, but what the state is paying is this year, or for 2021, $367,000, of which 145 is coming from other agencies, and then the balance is paid by the pharmacy board.
Okay, thank you.
Mm-hmm. Okay, we are now on the State Historical Society. Oh, the page again is somebody, 826 in volume 2. Okay, the State Historical Society will be due in FY 2021 and 2022. The agency estimates 2021 total expenditures of $7.8 million. Of that, $4.5 million is a state general fund. And that's operating expenditures of $7.2 million and capital improvement budget of $352,000. Sorry, just 1 second. Okay, thank you. They have 85.5 FTEs. The operating expenditures, the decrease is primarily attributable to decreased expenditures on salary and wages due to an increase in employee retirements and resignations, and the agency leaving some authorized FTE positions vacant, which I think we'll talk about. And then the governor recommends FY 2021 total expenditures of $7.6 million. This is an all funds increase of $4,500, which was a transfer from Spark that was submitted after they had done their budget. And that is from the special revenue funds, of course, Spark. And the governor recommends an operating expenditures of $7.2 million. It's an all funds increase of $4,500, the same thing. The governor recommended 2021 capital improvements of $352,000. It is the same as the FY 2021 revised capital improvements estimate. And the Budget Committee concurred with the governor's recommendations in 2021. Of note is that there were allotments in FY 2021, operating expenses of $21,703 and rehab and repair of $650,000. The agency went on to raise some of those, a lot of those funds, and so you'll see in 2022 kind of the result of those funds being raised and what happened. So that's FY 2021.
In regards to the capital improvements, where are the needs at?
So it's the State Historical Society. They are doing a massive redo of the Historical Society Museum.
Here in Topeka?
Is it in Topeka? Yes, it is.
Okay.
And then they also had quite a bit of repair that was needed because of flooding. The sidewalks and the basement flooded, and they had quite a bit of repair that was needed. And
Do we not have, well, we probably don't have flood insurance.
probably not. That's, yeah. And so, but as I'll explain, they requested $650,000. The governor in 2022 gave them $200,000 because they had ended up getting private funds to make up the difference for that. And our committee commends them for that, which I'll get to in just a minute. But that's what they requested and what the governor concurred with was quite a bit different for 2022 because of that. I'm getting ahead, though. We're still on 2021, I think.
That's fine. I also want to ask, in the funds that was received by the Spark Committee and approved by the State Finance Council was about $4,500.
Mm-hmm.
And was that just retained by the Historical Society? Was that spread out to some of the other museums across the state of Kansas? And I'm just saying that if that was spread out through the museums across the state of Kansas, that wouldn't be a very high dollar amount, because a lot of these museums, I know the one in my community was closed, and they rely heavily on donations to keep the doors open, and they were not able to have the doors open because of COVID-19.
Okay, just a second. They did not specify, Chairman.
All right, thank you. Representative Hoffman.
Thank you, Mr. Chairman. So did the governor go ahead and allot him the 10%? Was that allowed? Or the $691,000 that was allotted, that didn't come back to him, right?
Okay, are we talking 2021?
21, yeah.
Just a sec.
Looks like on page 833, there was an allotment of $671,000 as a result of the governor's July 1, 2021 SGF allotment. Is that what your question was?
Well, yeah, I'm just wondering where there was an allotment of 650 for rehab and repair. So that is above the 352,000, I guess. So had they asked for almost 900,000 for improvements?
So yes, the 650 was allotted. For 2022, they requested it back. And the governor put in 200,000 because in the meantime, they had raised $450,000 in private funds.
Okay, all right. I'm still not sure. But they did have 352,000 for capital improvements for 21 still.
Yes, and some of that had to do with the repair for the sidewalks.
It wasn't well, I was just trying to figure out how much we had gave them last year for repair and maintenance, and it must have been 900 and some thousand.
So, I mean, I'm looking at 2021, and it seems like it was $352,500 for 2021. So 250 from the SGF, and then other funds 102,000. So,
Yeah, okay. Well, that's fine.
but there is the 900 is, when you add it all up, they requested in 2022 $935,000.
Okay.
But the governor recommended only 600,000 because she took out the extra 350 or 450.
Oh, okay. And I'll talk to you about it later, I guess. But
Okay.
And then also the FTE positions, looks like they're adding an FTE position also. And have they filled all their other ones?
They're not adding one. Okay. Okay, so it looks like it was another position, but it went from classified to unclassified. So it's the same number. But I do need to mention that they have 70 positions filled, and they have asked for 85.5.
It probably went the other way. It probably went from unclassified to classified.
Okay, yes.
Yeah, okay. All right, thank you.
Mm-hmm.
Committee, any further questions in regards to fiscal year 2021? Seeing none, you may move on to 2022.
Okay, I'm glad you're keeping track of that, so that's good. Okay, so in 2022, the agency requests total expenditures of $7.8 million. That is $5.2 million in SGF. The request, the 2022 request is an all funds increase of $250,942 and an SGF increase of $679,000 or 15% above their estimates of 2021. The request is a special revenue fund decrease of $428,000 or 13% below the revised estimate. The request includes 85.5 FTE positions, the same number that they had the year before. The special revenue fund decrease is primarily attributable to decreased expenditures for other assistance, particularly the Historic Preservation Fund grants, and there was a reduction of fees collected during the COVID-19 pandemic. The governor recommends in FY 2022 expenditures of $7.1 million, including $4.3 in SGF. That was operating expenses of $3.8 million in SGF and $450,000 and for capital improvements decrease. And like I mentioned before, that decrease was due to the fact that the agency had raised private funds. The governor, part of that was offset by adding $115,000 from the Educational Building Fund for repairs to the agency headquarters due to the flood damage. And that was from the Board of Regents, gave that $115,000. Yes. Okay, so it does require transfer from the Board of Regents, the $115,000. The Budget Committee concurred with the governor's recommendations with the following notation. The committee commends the agency for raising a significant amount of private funds necessary for the restoration of the museum. The committee also recognizes the agency for realizing the importance of maintaining the quality of the museum site. Number two, the committee notes that the agency has worked very hard to maintain Constitution Hall, which is an important part of Kansas history, and the agency recognizes the historical significance of the property and has made significant investments to maintain the integrity of the site. And I'll stand for questions for 2022.
In regards to, it probably fall into fiscal year 2022 or possibly fiscal year 2021. Was the State Historical Society receiving any money from the federal government in regards to the relief package that was passed in December that you're aware of?
I think we asked them about that, but they were not, they didn't, it wasn't clear. Is that true, Martin? Yeah. Mm-hmm.
And obviously there might be specific information as how that money can be used, but could that possibly be used if they were receiving any federal dollars, be used for the rehab work that needs to be done in the museums?
That's a great question that we should ask them.
All right. The next, and maybe this is more of a comment, but I notice on page 837, it talks about the governor's recommended salary and wage adjustment. Obviously, it talks about the 2.5% state employee base increase. And then it also talks about the governor's intended plan of re-amortizing the CAPER's unfunded liability for an extension of 10 years. And actually, the way I'm reading this is there would be a reduction in this particular budget. And obviously, as far as I'm inclined to say, I don't think that's going to move forward in the legislature. So is there going to be an increase in the fiscal year 2022 budget due to the fact that we may not re-amortize the CAPER's unfunded liability? Is that something that we have to look at ongoing in other budgets?
We don't know. Is that what you? Okay, so they did not apply that to the budget analysis.
Okay, so just for the committee's awareness, this is probably something that we're going to have to analyze in many of the budgets, because the governor's recommendation from the agencies is going to be that might be a reduction in CAPERs, and so we may have to look at this. I just want to bring this aware. Because as I mentioned, it mentions it on page 837 in this particular budget. Mm-hmm. And this may be something that we need to address further, especially if the bill to re-amortize the CAPER's unfunded liability does not move forward in the legislature. Any further questions for Chairperson Humphreys in regards to fiscal year 2022 for the State Historical Society? All right, seeing none. Chairperson Humphreys.
Thank you, Mr. Chairman. I move that the House Appropriations Committee accept the House budget, the higher ed budget for the State Historical Society, approve the recommendations.
Committee, you've heard the motion. Is there a second? Second by Representative Ballard. All those in favor say aye.
Aye.
Opposed? Motion passes. And everybody congratulate Chairperson Humphreys on her first budget report.
Thank you. It wasn't too bad. Thank you.
We tried to be nice. Okay, committee, actually, we're going to go ahead and move on to working a bill that we had a hearing on some time ago in regards to House Bill 2021, and that is the issuance of bonds for a veterans home in 5 counties and the northeastern part of the state of Kansas. And so, David, are you available to give us an update on that bill for House Bill 2021?
Yes, Mr. Chairman. House Bill 2021, this would provide for the issuance of bonds to finance a capital improvement project to construct a state veterans home in either Douglas, Jefferson, Leavenworth, Shawnee, or Wyandotte counties. The total amount of the bonds shall not exceed $17.5 million. And these bonds would be used as the states required 35% match for the United States Department of Veterans Affairs Veterans Home Construction Grant Program. This will draw down a 65% federal match. So it'll be a total project of up to $50 million. Debt service for the bonds would be issued pursuant to appropriations from the state general fund or any appropriate special revenue fund or funds. The maturity on the bond shall not exceed 20 years. And this would take effect on publication in the statute book, so it would be effective July 1, 2021.
Are you through, David?
Yes, you can stay for any questions, Mr. Chairman.
All right, committee, are there any questions for the reviser? Seeing none. Representative Hoffman.
Thank you, Mr. Chairman. I would move that we would pass out House Bill 2021 favorable.
Committee, you've heard the motion. Is there a second? Seconded by Representative Prahl. Any discussion on the motion? Representative Helgerson.
Would staff or someone please refresh? I understand that it's up to $50 million in bonding authority. 65%, I think, is what the feds are going to pay. The remaining amount is coming from SGF.
Yes. David, I think you kind of elaborated on your comments, but is that the answer for Representative Helgerson?
Yes, I mean, the bonding that the state is under this bill would be $17.5 million. That would be the state's portion. Like I said, that would draw down the 65% from the feds, so that would be the $33.5 million. So for the total project for the home would be, up to $50 million, but the state portion here under the bill is $17.5 million from the bonding. And like I said, the debt service would have to come from appropriations by the legislature from the general fund or appropriate special revenue fund.
Representative Helgerson.
Okay, so we're putting up $17 million for the building of this. What about operational costs?
David, is there any specificity on the operational costs?
Mr. Chairman, there is nothing in the bill here specifically for operations. This would be for the actual construction of the home.
Representative Helgerson.
Well, if we're doing as if we're going down this path, I guess the question would be, is there going to be a loss? Is it going to be break-even type of situation? Is the agency going to handle this? How much of a need, and is the private sector not taking care of this? I think great if we need to take care of our veterans in this way. My only question is, what's the long-term ramifications?
Well, and I would assume, and David, correct me if I'm wrong, but it would probably follow in the same pattern as the current and existing veteran homes that we have in the state, as far as a payment and revenue structure. This is just for the construction of a home, because as we had in the hearing, there is not one in those 5 counties. And I was talking with Representative Wolfmore in regards to when we had the hearing, there was the discussion of land possibly being donated in Wyandotte County for the purpose of building a veteran's home. So that might draw down the costs of the construction, but this bill is just the construction of the veteran's home. All the operational costs, I'm assuming, would be the same as the existing veteran homes in the state. David?
Yes, Mr. Chairman, I believe that once if and when the home would be constructed, I think that would have to go. The operational cost would be, budget, request from the agency that would go through the normal appropriations process, as with the current homes.
Representative Helgerson.
All right, since it's a home for aging veterans, is it for memory care? Is it for nursing home? Is it for, all the different levels? This is a fairly, intricate decision. If you're going to spend $50 million, I assume that it's all thought out and there's a piece of document somewhere as to how many people are going into which type of populations.
Well, and again, I would probably assume that the operations and the care that is provided is going to be very similar to the current veterans' homes that we have in the state of Kansas. This bill just allows for the construction of a veteran's home. The care that is provided is probably going to be in the same auspices that of what the current veterans' home are acting in currently today. Representative Wolfmore.
So a couple of questions. So so we're not obligated in any way to pay for the operations? It's my first question. And the second one is, I don't even know how the other veterans' homes pay for their operations. So maybe that would help.
David.
I'm not sure I'm the best to speak to the current payment structure. I don't know if legislative research, the fiscal analyst might know better on the numbers and how the payments are structured in the current homes. I might defer to them.
Does this, and maybe I'll ask another question, but do you know if the state pays for those right now? I don't remember that from the presentation. If we're obligated, do we do that in the other veterans' home? Is that our responsibility?
Mr. Chairman, yeah, I mean, I think there are state responsibilities for the current soldiers' home and the veterans' home. I don't know how much additional funding there is. I mean, again, I think I'd probably want to defer either to the agency or to legislative research on the exact numbers, but there are some state costs.
And it was stated in the fiscal note, and I'm going to turn it over to Vice Chairman Hoffman.
Thank you, Mr. Chairman. So the fiscal note notes that of the two homes that we have now, the average cost is $18.2 million from all funds, and that's $2.8 million from state general funds that we pay over the last 5 fiscal years. That's what we've paid, $2.8 million. So we do pay a small part of it out of state general fund, but the bulk of it is paid. Says all funds, I would assume it's federal money from the VA. Another thing to point out on this is that this bill just simply authorizes them to go forward and saying, hey, if you are able to get the feds to move on a new home, we'll put up part of the money. So we're probably talking, from testimony, it sounded like it would be 3 to 4, maybe even 5 years before it's totally all finished. So this just simply gives them the authority to go forward and says we will. It's kind of like NBATH. If everybody remembers with NBATH, we had to put up a certain amount for them to go forward with the federal funding.
Representative Wolfmore.
Thank you, Mr. Chair. That was one of the points I was going to make. This could several years down the road before we're actually putting money into this. But the other thing is, they did report that there was land that possibly the mayor of Kansas City, Kansas might be willing to donate, Mayor Alvey. I checked with his chief of staff on the spur of moment just a few minutes ago, and she wasn't aware of it. That doesn't mean the offer's not out there, but I wouldn't want us to move forward thinking for certain that that land will be available, and I'll try and confirm that. Thank you.
All right, thank you. Representative Corbett.
Thank you, Chairman. What would be the occupancy or capacity of the facility?
David, do we know that? And that probably should have been a question asked during the hearing. This is just for the authorization of a construction. So I don't know if they know exactly what the occupancy would be, but David, do we know that?
I don't know that number. I think there was some testimony during the hearing on that, but I wouldn't want to comment on the number. I don't know if that's been finalized yet, so I don't know.
All right, thank you. Representative Ballard.
I'll comment a little bit on it, and I don't have my figures in front of it because the veterans is part of our budgeting process as well. But I think what Representative Hoffman just read indicated that, yes, we do have money from SGF. Also, they have their retirement benefits that really go into them living in the homes as well. And they do have, you know, I would say Alzheimer's wing, they have all of those things that the veterans need. And I'm understanding that that will be included in the new facility as well. Also, remember, they get money from the Veterans Lottery, and that's part of their operational funding as well. They anticipate that because if there's 5 counties around, that they will not have any trouble with occupancy rates. They have taken a big hit this year because of COVID and everything else, and they also have an aging population in Dodge City and Winfield. But they feel that with this new facility, it will provide the homes where it was too far to go and visit or for them to live there. But they will, because it's down the road, I don't think they have a plan, but they don't seem to be worried at all. I should say they're more confident they will have enough occupants to be in this new facility. And I think as it progresses, we'll find out the rest of it, but it will operate, as the chairman said, exactly as these other homes with all the different areas that they need and their staging. Also, family members are eligible to be with them just like they are at the other homes as well. Thank you, Mr. Chairman.
Representative Helgerson.
I appreciate the committee's patience, but the state is littered with projects that we start without a good financial plan and without a strategic plan. As I read this bill, this gives us the authority to issue the bonds if funds become available. There may be a great need out there. I visited several of the homes, and I think if that's the decision we want to make with our SGF dollars, that's appropriate. But if we don't have a strategic plan, if we don't have a recommendation from the building committee that says specifically, this is how we're going to make ends meet, and then we're going to come up with new SGF dollars in the future, those are the kind of demands we should make on our agencies and when a bill comes before us.
Any further discussion? All right, seeing none. Representative Hoffman.
Thank you, Mr. Chairman. I close.
Committee, you've heard the motion. All those in favor of passage of House Bill 2021 unamended, please say aye. Aye. Opposed? No. The ayes appear to have it. Division has been called. All those in favor, raise your right hand. Opposed, same sign. On a vote from 11 to 2, motion passes. All right, committee, we are adjourned. And actually, well, I have that note. Tomorrow when we reconvene, we're going to be actually having a discussion from the Social Services Budget Committee in regards to the ERO 47, combining the departments into the Department of Human Services and what they have recommended. And committee, we're going to be voting on the recommendation from the Social Services Budget Committee in regards to the ERO. We'll also be having a House Bill 2174 hearing, which is establishing the Rural Hospital Innovation Grant Program to assist rural hospitals in serving rural communities. And then we will have Budget Committee reports by Chairman Sutton. Representative Tarwater.
Thank you, Mr. Chair. I was just wanting to inquire on whether or not we have received a fiscal note on HB 2195 that we heard the other day from the Department of Labor. Have not.
We have not.
Thank you.
Anything else before the committee? Seeing none, we are adjourned until 9 a.m. tomorrow morning.